I'm Steve Wright, live in Chester. I was diagnosed in June earlier this year with prostate cancer, and that came about because last February I'd had quite a few colds and my wife suggested I have some blood tests. The GP was very good about that, and one of them came back with quite a high PSA, and that was the indicator that suggested that maybe things might not be right with my prostate. Having had the MRI, having had the biopsies, I went to see the consultants at our local hospital. It needed acting on. It couldn't just be monitored. And they then presented certain options to me, one of which was radiotherapy, one of which was surgery, so that was removal of the prostate. Neither of them sounded particularly wonderful, but we went away and we made our decisions, and I decided to go with surgery. And from that point then I was in the system, and I had an operation lined up for early September. My first operation was cancelled. My wife and I decided to go away on holiday, went to Spain. I came back about the 20th of September. My operation was lined up for the 24th of September. She was reading the paper and she said to me, "There's a piece in this paper about a treatment." She called it a new treatment. And I kind of raised an eyebrow and I thought, I don't know. I had a look at it anyway, reluctantly, believe me, reluctantly, and it mentioned ultrasound treatment. That weekend, I started doing some research on the internet, more than I'd ever done before in the months leading up to that, because I'd made a conscious decision not to sort of trawl the internet looking for solutions. I was going with what the experts had told me. Monday morning at 9:15, I'm ringing Focal Therapy Clinic. I spoke to a very helpful guy. I then arranged a meeting with a consultant down here in London, and that was Mr. Nigan. He spent a long time with us, explaining all the options, and one of them was HIFU. And he left that till the last. Maybe HIFU was the preferred option for me because of the low level of cancer and the fact that they caught it at early stages, and hopefully that it wouldn't have too much impact on my life after the treatment. Some of the side effects that were mentioned to me with the surgery were relating to erectile functions or urinary functions. That was actually more scary in many respects than having the cancer itself. With the HIFU treatment, it did appear that the risks would be less. The HIFU procedure was very simple and straightforward. It is done under general anaesthetic, but that was just as smooth and as sweet as anything. You know nothing about it and then you wake up again. After the treatment, I had a catheter for about 4 or 5 days. That in itself, I mean, that was no great discomfort. Everything's been very good, and touch wood, hopefully that's how it stays as well. I'm frustrated about the fact that HIFU wasn't presented to me at the time of my initial sort of diagnosis. But my hope is that going forward, men in my situation probably maybe do just take stock a little bit and also look at some of the options that are open to them, other options rather than just surgery, because it's pretty life-changing surgery, and I think it obviously concerns and probably scares a lot of men.